So now you can see that we've removed the ribs on this pony, and so all we have left is rib 7 and then the last few ribs here. And so that's all completed on both left and right sides, and now you'll continue and do your dissection within the thorax. So here you can see the left lung, and so the left lung will just have a cranial lobe and a caudal lobe in the pony. And you're actually going to look for some nerves. You're going to reflect the lung slightly and look for some nerves in here before you remove the lung. But for demonstration purposes, I'm going to go ahead and take out the left lung and then show you everything that you'll be able to see on this left side. So here I'm going to just remove the left lung. You'll be cutting it at the hilus, so that's where you have the bronchi and the vessels entering the lung. So you're going to go deep inside and kind of pull the lung away and reflect it, and you're going to cut those structures and then actually just pull the lung out completely. So once you do that, on the lung you can see there's all these structures, and so we have the primary bronchus would be here, and that's what's been cut away. And then the primary bronchus would then break into the lobar bronchi. So you'll have the lobar bronchi, and then those continue to split into smaller bronchi. Then on here we also have the pulmonary artery. So left pulmonary artery would be blue, going to the lungs. And then the pulmonary veins are all the red pieces you see here. So those would be returning and going into the left atrium of the heart. So pulmonary veins are red here, pulmonary artery here is blue, and then our principal or primary bronchus on the left side would be there. So now we'll go ahead and look inside the thorax. And here you can see that I've completed my dissection, but obviously there will be a lot more fat and fascia covering this area that you'll have to work through. So one thing you want to look for first is the vagus nerve. So that's going to be this one here. So that's what you're looking for before you remove your lung, so that you don't end up accidentally cutting it as you cut out your lung. So look for that vagus nerve before you take the lungs out. And then also you're looking for these lymph nodes. So in the pony, the tracheobronchial lymphocenter has tracheobronchial lymph nodes, which you can see one right there. So it's just this little guy right here. Caudal mediastinal lymph node right here. So caudal mediastinal lymph node, along with the tracheobronchial lymph nodes, creates that tracheobronchial lymphocenter. So you'll want to find those lymph nodes before you take out the lungs if possible. If not, you can look for them after you remove the lungs. Just try not to cut this vagus nerve as you take out the lung. Here you can see that cut edge of the left primary bronchus, right there. Then on the vagus nerve, so we're going to follow the vagus nerve and try to find where it gives off this left recurrent laryngeal nerve. So that's the one that goes around the aortic arch. So your aortic arch is right here. So the left recurrent laryngeal nerve will just wrap around that, and then we'll go back up the left side of the trachea. So here you can see I have it dissected out here. The trachea is right here, and it just is in that fascia right alongside the trachea. So it'd be kind of pushed in, attached to the trachea there. So left recurrent laryngeal nerve, you want to try and find that. Here you can also see the esophagus. So the brown tube running through is the esophagus. Here we can also see part of a thoracic duct. So I'll just elevate it here. But this is part of your thoracic duct here. Then we'll go back to that vagus nerve. So you'll continue to follow the vagus. You had vagus here, left recurrent laryngeal comes off, wraps around the aortic arch. Vagus nerve will continue, and you want to follow that and find where it branches. So here you can see a nice branching into a dorsal branch and a ventral branch. Then each of those will connect with the other side. So you'll have a vagus nerve on the right side doing exactly the same thing, and the dorsal and ventral branches then come together. So here you can see the ventral branch from the left side is connecting with the ventral branch from the right side, and then you would have the ventral vagal trunk from that point on. So here you can see the ventral vagal trunk on the ventral side of the esophagus. Then we have the dorsal branch on the left side, and that will connect with the dorsal branch from the right side further down the esophagus here. But here you can see from the left and dorsal branch from the right, they come together and form that dorsal vagal trunk right there. Then here, as long as we're in this area, I can point to a couple things on the diaphragm. So we have the esophagus running through the diaphragm, through the esophageal hiatus, which would be that hole it's going through right there. And then you also have this central tendon. So it's kind of that see-through part of the diaphragm. So central tendon would be here. After we take a look at a few more structures here, we'll actually look at the holes in the diaphragm a little bit more closely. Also on this left side, you can see the phrenic nerve right here. So you'll have to kind of work around that as you do this dissection and try not to break it. And we also have the sympathetic trunk. So sympathetic trunk is going to be way up inside the thorax, so I'll try and pull it up a little bit. It's hard to see, there's a lot of fat around it. But here I'm just going to pull it up a little bit. So it's that nerve running all the way along here. Oops. Up a little further. There we go. So sympathetic trunk is running along by the spine, and that will continue up this direction as well. So you can try and find that. So sympathetic trunk running up here, vagus nerve is the one down here, phrenic nerve even further ventrally. Then we look at the heart. So we have the pericardial sac that will be in the way and needs to be cut open. So you'll have to remove that very carefully. So you just incise and cut it open and peel it away from the heart so that you can see the external features on the heart. So as I mentioned on the lungs, we have the pulmonary arteries are going to be blue. So here's the left pulmonary artery, and that is coming from the pulmonary trunk. So pulmonary trunk is here. And then we have the ligamentum arteriosum. So here's pulmonary trunk, here's your aorta that I mentioned a little while ago, and you have this little connection between the pulmonary trunk and the aorta, and that is the ligamentum arteriosum. So also on this side we can see the left atrium would be here, the left auricle, left atrium, and then all of these red parts coming into the left atrium are pulmonary veins. We also have the left ventricle that we can see here. We have the coronary groove. So coronary groove runs around the heart, and it would be filled with fat in your specimen, so you kind of have to work through the fat. Here you can see I'll move the phrenic nerve out of the way. You can see the great cardiac vein. It's the blue one running around underneath the auricle here. So great cardiac vein. Hopefully we can see in there. And you can see the left coronary artery coming out right here. And then it will branch into these two parts. So you have the periconal branch here, and then you have the circumflex branch going around. So periconal going down, circumflex branch going around. And that's off of the left coronary artery. Then we also have the brachiocephalic trunk that comes off of the aortic arch. So here we have that aortic arch right here. And we have the brachiocephalic trunk is the really big artery right here. Then off of your brachiocephalic trunk, you'll have a left and a right subclavian. So here on the left side, we see the left subclavian, which is going to be this whole area right here. So this little piece is going to be left subclavian artery. Then off of your left subclavian, you have a bunch of vessels to identify. And on the left side in the pony, they have an extra one that's called the deep cervical artery. And so here in this pony, my branching is a little bit different than you would normally see, but I have this common trunk, and then I have the deep cervical going off this direction, and then my costocervical looks like it's going to be this one coming off and going towards the ribs here. So costocervical is one you need to find. But just know that it may be a little different on the left side in the pony because of this deep cervical artery as well. Then the next one here that you can see is the vertebral artery. Then you continue down, and if your veins are in the way, you can actually just cut them and move them out of the way. And then here we continue and see there's an internal thoracic. And again, this pony has kind of a common trunk for these two branches, but there's an internal thoracic that goes down inside the thorax here along the sternum. And then it also has the superficial cervical artery. So that's this one coming off right here, and you can see it poking out over here. So that's the superficial cervical that will go out and be superficial in the neck area here. Then the last piece we need to identify here is the axillary artery. So that would be this piece, the cut part is the axillary artery going into the left forelimb. So that's after it rounds the rib cage and comes into the limb, then it's called axillary. Before we move on to the diaphragm, I just want to point out a couple of veins that you can see from this side. So we have the external jugular vein, which is up here by that subclavian artery that we just worked on. So external jugular is coming in here. And your subclavian vein would be here as well. And then those two come together and form an almost non-existent brachiocephalic vein, but that's not on your terms list, just so you know that those two do come together similar to the dog. So external jugular vein, your subclavian vein would be here. Then the other one, once you remove the right lung, you'll also be able to see the caudal vena cava. So if you move the accessory lobe of the right lung off of it, you can see that caudal vena cava there. And then the last thing I want to show here, if I just move the pericardial sac out of the way, is the thymus. So this pony has a little bit of thymus, just right here. It's kind of a triangular shaped blob here right in front of the heart. It's the thymus in this pony. Okay, so here we're just going to take a little bit of a close-up look at the heart. And so the structures we see here, the pulmonary trunk is here, and that's coming from the right ventricle. So we can't quite see it, but just a little bit of it here. So right ventricle would be over there. Pulmonary trunk is here. The left auricle and the left atrium are right here. Left ventricle is here, and in between your pulmonary trunk and your auricle is what I want to show you. So you have coming off of your ascending aorta, so that's the very first part of the aorta as it comes out of the heart, you have this left coronary artery right here. So left coronary artery, and then that branches, and you can see those two pieces. So it has the periconal branch coming down, and then you have the circumflex branch. So the circumflex branch is a little hard to see because I can't really move this auricle. It's filled with latex. But the circumflex branch comes right underneath the auricle here and wraps around. Then you also see that great cardiac vein there as well. So those are running along that coronary groove. So circumflex branch, periconal branch, both coming from left coronary artery. So here we're looking a little closer at the diaphragm, and we have the crura, which are something I want to try and point out. It may be a little difficult to see, it's pretty dark in there, but the crura are the muscular parts that kind of surround the esophageal hiatus. So you have your esophagus here. The esophageal hiatus is the hole that the esophagus runs through the diaphragm. So esophageal hiatus, and then you have your crura. So you have a left crus and a right crus. And so these are just the muscular portions right here of the diaphragm. So those are the crura. And then your aorta, so you have your descending aorta here, and that will go through the diaphragm, through the aortic hiatus, right there. So that's the hole that the aorta goes through. So aorta, aortic hiatus is the hole. Esophagus, esophageal hiatus is the hole. And then we'll talk about the caval foramen, which is the other hole, and we'll talk about that on the right side. So now we'll go ahead and move over to the right side and look at these structures for this lab on the right side. So here on the right side, you can see we've done the same procedure and removed all of the ribs except for that last rib, or the last few ribs and rib 7. So now we're going to look at the lung on the right side. So the lung has cranial lobe and caudal lobe on the right side, just like the left side, but the right lung also has an accessory lobe. So as you're trying to remove this lung, you have to kind of move the accessory lobe, if you kind of use your hand, and push it up and around that caudal vena cava to get the accessory lobe out. You'll see what I mean once I take this out. But you're going to be removing the right lung, just like we did on the left side, but you're going to look for those lymph nodes and the vagus nerve first, and then cut all the structures going to the hilus and remove the lung. So here, I'll take it out and I'll show you the accessory part. So the accessory lobe is just this part. So here's the cranial lobe, the caudal lobe, and then you have this little guy as the accessory, and that's what's wrapping around that caudal vena cava. So you just have to kind of pull it out before you can remove the lung. So that's the right lung. Same thing as on the left lung, you have the principal bronchus will be there, and that'll break into the lobar bronchi, so you'll have a cranial, a caudal, and an accessory, and then those continue to break down into smaller and smaller bronchi. Here you have the red are the pulmonary veins, and then the blue is the pulmonary artery, which is already branched here, so we've already got branching going on, but you have a right pulmonary artery, and then those break into the lobar pulmonary arteries. All right, so then we'll move on and look at the thorax. So here from the right side, the view is similar but slightly different. So here you can see the right vagus nerve. So that's what you're going to look for before you remove your lung. So the right vagus nerve is here, and you're going to want to trace that caudally and find the branching. So you want to do that before you remove the lung because you're cutting the lung right here, which is right below this nerve. So just be very careful when you're taking out the lung. So this would be your right principal or primary bronchus on this side here. The trachea is here. You have your esophagus running down, so esophagus there. Then on this right side, you have a really nice view of your cranial vena cava, which is here, and then your caudal vena cava, which is here. So we'll go back to our vagus nerve for just a moment, and we'll also find these little lymph nodes that are kind of hiding. So we have some tracheobronchial lymph nodes, just like we did on the other side. So this little guy would be a tracheobronchial lymph node, and there's a couple more probably right here. And then we're seeing kind of on the midline is that caudal mediastinal lymph node that we saw from the other side. And so all of those lymph nodes together make up the tracheobronchial lymphocenter. So then we'll continue, we'll follow our vagus and find where it branches. So you'll have a branching point. I'll try and move this lymph node out of the way so you can see it. So you'll have a branching point where it splits into a ventral branch right here and a dorsal branch. So recall that the left side did exactly the same thing, and then you have your ventral branches coming together. So you can see the other side coming in here. Ventral branch from the left, ventral branch from the right, coming together, forming the ventral vagal trunk. So that will travel along the ventral side of the esophagus here. So ventral vagal trunk. Then here we have the dorsal branch from the right side. And as you trace that caudally, you'll find the dorsal branch from the other side that comes in with that. So hopefully I can get out of the way enough to show you. Here we go. So you've got dorsal branch from the right, dorsal branch from the left. Those two come together and create this dorsal vagal trunk running on the dorsal side of the esophagus. So esophagus is here. We have that diaphragm that we just looked at a little bit ago here. So we have the central tendon, is this kind of see-through part. The esophagus goes through that esophageal hiatus. And it may be easier on the right side, slightly easier, to see the crura. So they're kind of surrounding that esophagus. So you can try and look at those. Then on this side, we also have the caval foramen, which is the hole that the caudal vena cava travels through in the diaphragm. So caval foramen would be right here, where the caudal vena cava goes through the diaphragm. Then we have some nerves to look at. So we already looked at the vagus nerve, which is this one here. Then we have the phrenic nerve right there. And we also have the sympathetic trunk. So that's the one that's way up by the spine. So right here you can see hopefully sympathetic trunk, but you'll see kind of a white line running along the whole back. So that's the sympathetic trunk running along, and then hopefully you can kind of pull it out and see where that's going. So sympathetic trunk running all the way up here. So sympathetic trunk, vagus, phrenic nerves. Also, one thing to note on your vagus, you do have a right recurrent laryngeal nerve, but it's really hard to find and hard to see. I'll try and show you here on the demo. But so you have the vagus nerve here, and you have this really tight circling around of this artery. So this part that's going back up the trachea, it's coming off right here and wrapping around that artery, and it's going up the trachea. So this should be your right recurrent laryngeal nerve. And again, you can find those going up the trachea in the neck as well on either side. But that right recurrent laryngeal is a little harder to find down here in the thorax than the left. All right, so then we talked about the cranial vena cava here and the caudal vena cava here. But then we also have the right azygos vein. So that's the one that goes up here and towards the back and kind of runs alongside this sympathetic trunk sort of right there. So right azygos or just azygos is fine. And then we also have part of a thoracic duct running right alongside that as well. So it's pretty hard to see in this guy because it's not very full, but it's kind of this dark line right underneath your azygos vein. It's part of that thoracic duct there. All right, so then we'll take a look at the heart for a brief moment here. So you have this pericardial sac that needs to be reflected, just like the other side. So you can kind of just pop the heart out of there. Here you can see a little bit of thymus poking out here from the other side. So thymus there, pericardial sac is being reflected there. And then we'll take a look at the right side of the heart here. So you'll have the right atrium with the auricle. And then you have the right ventricle. This side, you just have the right coronary artery coming off of the aorta. And the right coronary artery will kind of travel around the coronary groove here. And then it terminates in the pony as the subsinuosal artery. So that's here traveling distally here. So subsinuosal artery is the termination of the right coronary artery in the pony. So now on this side, we can't see much of that external jugular vein, but you can, it's in the neck, obviously, so you can see it up there. But here we just have a little piece kind of poking through. So we have external jugular here, your subclavian vein here. Those two will come together, kind of form that almost non-existent brachiocephalic vein, and then the brachiocephalics come together to form the cranial vena cava here. And from this side, we don't see much of the brachiocephalic trunk, so just a little piece of it here, kind of under the vagus nerve. So brachiocephalic trunk. And on the right side, you should have a right subclavian. In mine, they kind of just start branching. But this whole thing right here, not the nerve, but the rest of it, all the arteries, would be considered the right subclavian artery. Then you have the different branches from the right subclavian. So we have the costocervical right here. We have the vertebral artery there. We have our internal thoracic artery here. And then we have superficial cervical is a little bit smaller and it's kind of hiding down in here, but hopefully I can pull it up. There we go. So superficial cervical is right there, and that will go out here into the neck. And then your subclavian then changes names after it rounds the rib and comes out of the thorax. So this would be called axillary at this point, where it was entering the right limb. So axillary here. And then we will move on and look at the termination of your brachiocephalic trunk here, then gives off the right and left subclavians. Then it continues as the bicarotid trunk, which is really difficult to see, but it's right there. And so that's going to be the final termination of the aorta going up to the neck here. So you have the bicarotid trunk that gives off your right and left common carotids. So we'll take a look at that from the cranial view, so from the front view in the neck. So here we're taking a look at the ventral midline in the neck, and what you want to do here is split your sternomuscles. So kind of go right in the middle and split those open, and hopefully you'll be able to achieve this view by going that direction. So you can kind of split those apart and then see where your bicarotid trunk is coming out of the chest here. So you have the bicarotid trunk is the big part, and then you see it split into two. So right here you've got that split happening. So bicarotid trunk splits into your left common carotid artery and your right common carotid artery. So again, bicarotid trunk down where my thumb is there, splits into left common carotid artery and right common carotid artery. Also on the heart in this view, we have your pulmonary veins. So those are the red ones here. So pulmonary veins would be there. And then your pulmonary artery on the right side is coming out here. It's already kind of branching. So the right pulmonary artery there. Pulmonary veins are here. And then one other thing, right under your caudal vena cava, you have the great cardiac vein coming around. And so it's emptying into the right atrium at the coronary sinus. So that'll be inside the heart, but you can see the great cardiac vein kind of coming around here. And it terminates right there. So great cardiac vein is right there.